Welcome to our panel, our new panelists who are going to join us in this discussion where we'll talk very specifically about COVID-19, the impact of COVID-19 on patients and the impact of COVID-19 on patient advocacy groups and how they've responded. So I'm delighted to have joining us in the panel. So we have Elisabetta Ricotti, who is from ACTO in Italy, a patient advocacy organization. Elisabetta, welcome and thank you so much for joining us.
Thank you, Clara.
Excellent. And we have, I'll come right back to you. We have Lisa Balsam, who is from the Dempsey Cancer Center in the US. Welcome, Lisa. You're director of programs for that center, so I'm sure you'll have lots of insight to share. We're going to start this session with presentations. So I'm also delighted to have joining us Iko Toth, who is the co-chair of Engage, which is the European network of gynecological cancer patients, and it's associated with, it's gone right out of my head, I'll come back to it. ESCO. Thank you very much. Thank you. And it's going to share some findings from a survey that Engage did with gynecological cancer patients in Europe. And then welcome Frances Reed, who is our World Ovarian Cancer Coalition Program Director. And Frances has been leading on some survey work, both for us, but actually as part of a wider cancer coalitions group looking at the impact of COVID-19 on our organizations and what they see as the impact on patients. So if we'll start with that. So Iko, if you could start, and please feel free to fill in a little more if you want about your organization. You're also actually CEO of the Mallow Flower Foundation.
Yes, thank you so much. And thank you for the invitation. I'm trying to share my screen. So thank you so much. So yes, I'm the co-chair of Engage in Europe, and also I have a foundation here in Hungary, the Mallow Flower Foundation, and we work for all gynecological cancer. Here we are the one and only organization here work for these fields. And I'm very happy that I can see the European level as well, and I can work with so much very nice and good colleagues. So what you can see, this is a result of a survey, and with Engage we really wanted to create a brochure when the world had the first wave of COVID. We wanted some bullet points or brochure, but then we realized that we didn't know any about the patient perspective. So how can we produce something without the patient perspective for the patient? So therefore we started this survey in Europe, and you can see above that we had ovarian cancer, cervical cancer, uterine cancer, and rare cancer patients, and they were under active treatment or follow-up. So the main findings are that 73.2% named cancer as a risk factor for COVID-19, almost all due to the chemotherapy. 17 were more afraid of COVID-19 than their cancer condition, and 71% were concerned about cancer progression if the treatment or the follow-up was cancelled or postponed. What we saw from the survey, which was 1,388 fillings, and the majority was ovarian cancer patients, that the care continued in these countries, 64%. And it was almost or rarely 6.2 who difficult to reach the doctor. So I usually say that this 6% is also very high for us because the doctor is the bastion during the disease. So if we cannot consult, especially during these therapies, we can lose our sense of security. So therefore, this is very important. Approximately half of the patients expressed their fears of getting infected with the virus from the hospital or the clinic. We measured the anxiety and also the depression levels of the countries, and ovarian cancer patients had higher anxiety and depression level in each country. what we saw that the highest anxiety and depression level was in Poland, and then Italy, and then the Czech Republic, and then Turkey. Now we built on this information, and I can say that we are in a very lucky situation as we have wonderful members in Engage, and Andrea, who is here with us, and Jalit Shehuli, Professor Jalit Shehuli had a very nice brochure on this COVID topic for the patient. So Andrea can translate it into English. And now we can say that we, as Engage, add some thoughts and some note on it. So it is coming, I hope, next week or in 2 weeks, and we will have our validated COVID brochure. So I can say that because the patient perspectives are in this brochure, and this is very important. So I think they are the most important side of what we can see from Europe among the patient. And that's another story, how we, patient organization, can handle these problems.
And we'll come to that. And thank you for sharing that. It was a brilliant survey. And I will say it's been published in a journal, so very, very validated results. So some really kind of interesting points in there, which we'll come back to. So Francis, would you like to share your survey results?
Okay, so I'm going to talk to you about the impact of COVID-19 on ovarian cancer patient organisations. It's the findings from a wider survey by a newly formed or newly named group, I should say, the Global Cancer Coalitions Network, which includes coalitions like ours, but also in pancreatic, lymphoma, brain, kidney, bladder, advanced breast, lung, colon, and I may have missed some off there, but a really wide network, and we've been talking regularly during the pandemic. So I'm going to share with you the ovarian findings. Our overall findings aren't yet released until the 4th of February on World Cancer Day, when we'll be having an event, and there's information about that later. So as I said, this actually comes from our second survey. We did a survey last June, and the results were fairly horrifying. And we got some really good coverage in places like Lancet Oncology, Cancer World, and so on. And we wanted to follow up and see what was being experienced back in June, was that still continuing, and were the predictions that were in June, had they materialized? In terms of our responses, we had 13 from organizations helping women with ovarian cancer from 9 countries. In touch directly with over 17,000 or nearly 17,000 women who have ovarian cancer. At the time of the survey, most were in their 2nd or 3rd wave of the pandemic, and cases were either rising or peaking. So operating in very difficult circumstances. It's interesting to note that nearly 4 in 10 have no paid staff, and a similar number have 3 or fewer staff. So, you know, very few people employed and directly working in these organizations. 3 of those 5 who had 3 or fewer staff have actually lost at least 1 post in that time. Overall staff numbers were down 6.5%. Every single organization relies on active volunteers, but levels have plummeted by a shocking 87.9%. And that was really worse for ovarian cancer groups than for some of the other groups, perhaps reflecting the nature of the disease. And all organizations primarily are working from home to some degree, with the majority being all at home. We've heard a bit from Eco there about the impact on patients. We asked about whether services such as screening, diagnosis, urgent referrals, surveillance, that type of thing had returned to normal. And on all counts, we're still a long way from being back to what you might term pre-COVID normal. And in quite a few cases, we are worse than ever. So still a long way to go with that. We asked specifically about whether the patient organisations felt that levels of stress, anxiety and depression, isolation access to food and medicines, and financial hardship were improving, worse than ever, and so on. And you'll see here really not very good results here. So nearly 40% saying actually things like stress, anxiety, worse than ever. Over 50% saying feelings of isolation as patients, worse than ever. And financial hardship, again, 50% saying worse than ever. Very little is back to normal. In terms of the services that these organisations deliver, these vital services that we've been discussing over the last couple of days, 2 out of our 13 respondents are currently not able to offer services because of restrictions due to local restrictions or national restrictions in their country. Many services have altered. In particular, face-to-face support and healthcare professional education have ceased. And online support and COVID information were the activities that were most likely to have been started and introduced. So organisations have had to shift to home working, they've had to shift what they offer and how they offer it. The role of technology. I mean, here we are all on a Zoom call from right around the world, and most organisations feel that they have adopted these new technologies in a lasting way, and it will change the extent of the relationship that they have with some of their supporters and those in need. But almost 1 in 3 of the organisations said that they actually needed more help to optimise their use of technology, and that in some instances included better access to internet and Wi-Fi, or it included, improving their own skills in this area. Almost every organisation in the ovarian field provided helplines or online forums, and 42% saw an increase in calls, with an average increase of 40%. It's interesting to note that some of this goes with sort of peaks and troughs of Covid-19. So as the disease is more prevalent, calls go up, and as it drops back down, calls fall again. Others have actually seen that because of their digital presence, their calls have gone up and stayed up because they are reaching new people. There is a lot of concern about those who are digitally deprived, and in particular about elderly communities. And some fear was expressed about the difficulty of providing online support as opposed to face-to-face. Funding. Here comes the bad story, really bad story. In June, predictions were dire. I think it was something like 75% were predicting a fall in income. In the overall survey, a slightly lower proportion experienced predicted losses, but for ovarian cancer, that was higher. Staggering 84.6% experienced falls in income, and the average drop in income, this is actual drop in income, was 45.5%. So a fundamental shift and challenge in terms of the ability of organisations to survive. And just 1 organisation out of the 13 that responded to us expects their 2021 income to be at levels seen in 2019 or above that. All funding streams were affected. Nearly 4 in 10 have successfully applied for emergency government funding, but that only exists in high-income countries. So you see a similar proportion say no such scheme exists in their country. And more than half of the groups that responded said their viability is either threatened now, or it may well be in the future because of this lack of funding. Our message to you is, you are not alone, and we will champion you as a coalition. We will champion the vital services that you are delivering. You're involved in negotiations and discussions about cancer care on regional, national levels. You are working in extraordinarily astonishing, challenging times. We are calling for increased support from government and from those who can, pharmaceutical companies, anybody who can provide some extra financial support. And the full report of all the coalitions will be published on the 4th of February. We're seeking global coverage, and we hope you will use the report to help appeal to your potential funders to help show the vital work that you do, and we do hope you'll join in on the event on the February the 4th. Thank you.
Thank you, Frances, and thank you, Ika. That's so interesting and maybe not surprising, but quite shocking, really, I think, in terms of the impact of the pandemic. Lisa and Elisabetta, welcome again. Thank you for joining us. We're really delighted to have you here. And you're both have experience from the cold phase, but from the patient advocacy organization starting point. Elisabetta, if I start with you, can you tell us, do those findings ring true? I feel certain they do. What is your experience, and what has ACTO, your organization, done? How have you responded to the pandemic?
ACTO, I should remind that is a network. The first national organization was established in 2010, and then it grew up to 8 organizations. We are working all together. We share the same mission, and we worked all together even during the COVID pandemic. Mm-hmm. Okay. Our mission is can be summed up with 3 words: information, support, and advocacy. So we worked in all, either on the national or regional level on these 3 pillars. We started with information because patients were feeling afraid of not being able to be treated, afraid of being infected with COVID. So the first thing was to inform them that they could go to the hospital, continue with the therapies, because cancer centers were COVID-free, because it was a decision by regional and national government. So they were able to be treated. In case they were not able to be treated in their hospital, they were referred to COVID-free hospitals. And then they could even have a blood test or out of the hospital and be in contact with their medical staff. In the same area of information, we also acted at regional level, because our affiliate Acto Piemonte launched a social media campaign about about hospital is a safe place to go. And even Acto Lombardia did this. And this was the first step we took to tackle with the COVID pandemic and the fear of being infected. As a matter of fact, it was a necessary step, because patients tended to delay controls. So it was important to tell them not to delay controls, not to delay their follow-up tests, and even not being afraid to go to the hospital if they felt strange symptoms, in case they had no diagnosis, but they had strange symptoms. It was necessary to go to the hospitals, because they were safe places for them. The second pillar was the support, and support, we were able to arrange, with the help of pharma companies, new services. For example, home delivery of oral drugs, okay, PARP inhibitors, home collection of blood samples, telemedicine visits with their medical staffs, and many other services. ACTO as a network was involved as advisor for some pharma company to bring them the insights of the patients, to find new kind of services we could offer patients during the COVID. And hopefully these services will stay even after the COVID pandemic, because there are many patients who are alone. So perhaps they have to go to the hospital and they need someone who can drive them, or they can't go out for things to do, and they need people that can make all these things for them.
Brilliant.
There is one interesting thing also Acto Lombardia did for supporting patients. They launched a series of video appeals on the social media with psycho-oncologists, trainer, and other experts who were a sort of way to make patients less isolated, because it was a sort of supporting them emotionally with advice on how to train at home or how to take care of their skin during therapies. And it was included in a larger project by Acto Lombardia, which is called the Casa delle Donne, the ladies' home, and who's going to be every 2 weekends, either digital and when it will be possible, in person. So it's sort of a scenario of what we did during the pandemic.
I think that's brilliant. And those things are, so in some ways the simplicity of just bringing medicines to people rather than making them come, or providing digital access to support. So, yes. And I love that you have been working with industry, with, health professionals right across the board. And I think that's just a very, really great example of a patient advocacy organization being right at the table and influencing, policy and practice from the patient perspective.
Clara, we have our names is Alleanza contro il tumore ovarico. That means that we're an alliance among the doctors, patients, national agencies, and researchers. So we always work together.
Thank you. Brilliant. And Lisa, if I can come to you, and maybe you could start by saying a few words about the Dempsey Center and your role. And we invited you here because really we felt that your organization really exemplifies good practice in terms of supportive care. And we know that you support many, many patients across the USA. So maybe start by saying a few words about that, but it would be, again, if you could respond to really some of those findings, which are quite shocking. And I still find I think ECO's finding about, the patients more afraid of COVID-19 than their cancer, and the psychological impact of that for sure. And some of Francis's points about the practical impact that I'm assuming your organization has also had to deal with. So if I could turn it over to you.
Yeah, absolutely. And hopefully you can hear me a little better. I was having some mic issues, so just let me know if I am not loud enough. So I work for the Dempsey Center, which is located, we have 2 locations in the state of Maine, and now have what we call our 3rd center, which is our virtual cancer support center called Dempsey Connects. The Dempsey Center was started by Patrick Dempsey, an actor, in 2008 after his mother was diagnosed with ovarian cancer back in 1997, and found that there wasn't enough cancer support outside of the hospital setting. And so with that, our real mission is to make life better for people managing the impact of cancer. And that could be anybody managing cancer as an impact to them. Listening to the previous session, talking about caregivers and care, we like to call them care partners. So the care partners for our clients, so their family, anybody in their family, the children. We have lots of services. We call that our Healing Tree Youth and Family Services, and I can come back to the what we do. But in relation to the actual study, I was actually really shocked with Francis's component. I had no idea that other organizations were struggling that bad, and that just makes me feel like I need to step more out of my bubble here in our outside of the center. Our staff here, we're a nonprofit. We have approximately 24 staff members and over 80 volunteers that work with our organization. We shut our brick and mortar doors back on March 16th of 2020 with most of the rest of the world, and have not returned, although I am the only one in the building at the moment. But we have not brought our clients back into our center. And on March 30th, we switched every program that we have to a virtual component. So everything now is online, which is what I mean by that Dempsey Connects program. So we offer things like counseling. So we do one-to-one counseling with licensed clinical social workers via virtual components. We do all of our groups. We have 8 different support groups that are part of our model that we continue to have on a weekly basis, also done virtually. We do nutrition counseling or consultations with clients via online. So everything, I'm just going to blanket say everything's online. So we do consults virtually. We also hold classes with things like food as medicine and what to eat. We do movement and fitness consultations. So if you want to talk about, we like to think of it more as how to help you move more through your treatment, not that you're going to become fit through your cancer treatment. And so we offer consultations with our fitness specialist, and then do offer yoga classes, Tai Chi, Qigong. We also we had a very strong complementary therapies program before our doors shut, in that we offered massage therapy, acupuncture, and Reiki. And we've actually transitioned those to virtual components of doing, our massage therapist now does online classes for our clients to teach them how to do self-massage. We do acupressure classes. So we have really taken everything for those supportive services. And as I mentioned, Healing Tree for those families we were talking about in the previous session, doing counseling with children virtually, depending on their age, obviously. And then we do have a teen group and a young adult group, specific to what Allison was saying earlier about young women. It's young folks want to feel like they're talking to people a little bit more in their own age group. So we did start that group actually during COVID, and surprisingly has grown into one of our more popular programs throughout this. The last thing we just recently did, part of the COVID component, was what we call our Cabin Fever series. And that was really not about anything cancer related, although you are a registered client of the center because of your cancer, but it was to do things to bring you, or to make you feel less isolated. So we recently just did one with a horticultural therapist to teach you how to take care of your plants indoors. We're doing some drawing classes, some journaling classes, some music therapy classes, just to try to help people feel less isolated during this time. We totally transitioned, so it was a big shift for us, and our staff went from literally no virtual services to everything being virtual within 2 weeks, and have done an amazing job. It was always part of our strategic plan to do that within the next few years, but because of the pandemic, it just sort of forced us to do that. As far as
oh, I think somebody's mic, maybe someone turn off their mic. Carry on. Thanks.
As far as the reporting, I absolutely would agree with both of the surveys. We absolutely have seen all of those things. Our largest increase in service is in the counseling sector. We've actually hired 2 more counselors that are starting next week, where our wait list has grown exponentially for counseling services to try to help people through this time of the pandemic, as well as the cancer diagnosis. I can say from firsthand, hearing stories like having to decide, well, I don't want to start chemo until I have my COVID vaccine. That is an unbelievable decision that somebody would have to make, that I am going to risk potentially having my cancer worsen so that I can be vaccinated, because I don't know what would happen if I try to get vaccinated during chemo treatment. So we hear a lot of unfortunate stories throughout. Obviously, for us, that silver lining is all of the services that we still can offer, and try to keep offering that supportive care to folks. The other thing that we've been trying to do is call what we're calling caring calls, where we reach out to all of our clients, and we just keep cycling back through and then writing down who wants to, or making note of who needs another call, to reach out and just have a conversation and hear how they're doing. What can we do? How can we support you more? It certainly helps us as an organization understand what the needs are, and then we'll go ahead and create that program. If we hear it from multiple people, my job as the client program director is to sort of figure out how can we turn these programs into what people
Wow, that's amazing. And I will say one of the reasons that we particularly like your organization, as you've described so well, is that holistic approach. It's not just cancer, it's someone who has a whole life around that, and just the your services really clearly are designed in that way. So that's really, and it's such an interesting insight into the tension between fear of cancer, fear of COVID-19, and having to make incredibly difficult and just very difficult decisions about next steps. Iko, I'd like you to come in now, if you don't mind, because in addition to your co-chair role at Engage, you run the Mallow Flower Foundation and support patients. What are your reflections, and how have you, as an organization, responded to COVID-19?
Thank you. I'm just first would like to connect on Lisa, because that's really true that we need to see clear the needs and then we can act. And I think this period we had to be so quick, and this was really difficult for all of us. So we needed also to change our strategy, to change our office work, and also the programs and the funding so suddenly. And I think most of us succeed well. That's okay that we had no enough funding and no enough people around, but patients are there, so they needed us all the time. What we did is similar, and I think that the telehealth and the telemedicine has a very big advantage. And I believe that NGOs have roles in this telemedicine and telehealth as well. This is not just for the healthcare professionals, the doctors or the nurses or the psychologists, but for us as well, NGOs. So we had online reception with the doctor each week, and it helped a lot. What was really interesting that we had been collected the questions from the patients in advance. And most of the questions were about the treatment. So not about the COVID, but the treatment. They really wish to have maximal effort, care, and also the high quality of care. We encourage them to have a special plan with the doctor, with the nurse, with the healthcare professionals, and include the time, the meeting times, the connections, who can they call when it is an urgent problem or so. Basically, we need this plan, but especially during this COVID period, it was very important. Also, we had the same online gymnastic and sexual health webinar. This topic is very important.
Oh, I think we've lost Iko. That's okay. I will come back to her. But Andrea, do you mind? Because you're obviously you with your support group, so I'm interested. So your network of groups responded to a need about the need for for women to come together, and so something like COVID-19 obviously makes that impossible. How do you respond to that?
Yes, we do once a month online a Zoom conference, which is called Meet the Expert. And there we invite as well doctors who are specialized on COVID or on immunology or something like that, so that the patient can ask the doctor directly via Zoom everything they need to know.
Thank you. And Iko, just to go back, you dropped out.
Sorry.
I don't want to.
I did not realize that I was frozen. So sorry.
Another Zoom experience.
Thank you, Andrea. Thank you that you take the time. So yes, and we had several articles in our website. We created a sub-site about the viruses, and we had videos in televisions as well, not just talking about the situation, but offer our services more than before. So So yes, and I think, yes, we succeed well, and we did a lot.
Yeah.
And we are so exhausted, but
Yeah.
but the next wave's coming, so we need to prepare again. But we are now, I think, more clever, because we can plan our year, that we have some information behind. We can build on our program before, and also what Elizabeth told, that we can have several programs what we had during the first or second waves, and which are very good, so we can continue.
Brilliant, brilliant. And I think you're so right. I think the whole sector really, switched over so quickly and under such pressure, and just amazingly inspiring, and I think speaks to the professionalism and of our colleagues. So Alison and Magna, I think I'd like to come to both of you, because you're both in the health service, and it would be really interesting to hear your perspectives on the impact of patients and healthcare professionals as well. Alison, maybe we'll start with you. Oh, you're still on mute. Thank you.
I'm such an amateur. Firstly, I just want to say I'm so impressed with how your services have adapted so incredibly quickly, and some of the amazing things that you're offering. And I really hope some of those continue post-pandemic. I love the idea of how to look after your houseplants, for example. A lot of my patients, they grieve that they can no longer double dig their allotment. So, having just smaller achievable goals like managing houseplants is just so important. Certainly in the first wave, we saw in England, things just stopped pretty much. I think from my patient's point of view, one of the biggest impact was the shielding letter. Life is precious for everyone, but if it's limited potentially by cancer, patients were angry. They felt completely robbed of that precious time to see family, friends, to travel, to live their bucket list, for example. And that's been very heartbreaking for people. It's been particularly cruel. I had patients saying to me, I really want to see my mum, but I'm not allowed because it's lockdown and I really need to give her a hug. Things like that. So we need to think about them. I love all the idea of all this sort of online stuff that's going on, the counselling, the classes, etc. But I'm also conscious of the patients I see, particularly the elderly patients who even struggle to FaceTime their friends and family and need help all the time with that. They can't manage a smartphone. And for that reason, we've introduced virtual visiting so that the staff have iPads and we connect them that way. But even their family at home sometimes don't have the technology. So we really must remember those people who fall through that technological gap.
Agree, totally agree. I think that's a really, there are, and we'll come to this sort of as we wrap up, but some silver linings and innovation and, wonderful things we'll hold on to, but there are pockets of people and in different circumstances where, we need to do something else. Magna, do you want to say a few words about your, in-hospital experience?
Yeah, well, I can talk about the direct patient care that we provide and how it was affected, because in the first wave, obviously people were not prepared and it was very sudden, and that kind of affected what we could do for our patients, because suddenly all our surgical lists were going down, and I'm sure medical and clinical oncology were also affected, where they could not carry on giving them the chemotherapy regimen. And that definitely, because having been a patient, if I was on that side, I would have definitely been very scared that a delay of a few weeks might make a difference in my long-term outcome. So it was a very difficult time for us as clinicians, and probably a lot more so for the patients. And it was really all our beds were being used for other reasons. I have to say we were again privileged, because working in a cancer cancer-only hospital, we were very quickly turned into a green area where they tried to keep it COVID-free. And we started very quickly, within a month, taking referrals from other hospitals who were overwhelmed with acute work, and we started taking the cancer patients from them. And after the first month, we actually were operating a lot more than we normally did. So I think we were pushed as staff, because the number of staff still remained the same, whereas the operating but it was great that people pulled themselves together and were ready to operate longer hours. And instead of working like 2 sessions, people were working 3 sessions and finishing an operating list at 7:30 or 8 in the evening, rather than finishing at 5 o'clock. So that did hopefully help some of these patients. But in the second wave, I think people were a bit better prepared. And I can only talk about my personal experience. I do not think this may be the whole country, because hospitals which are also dealing with COVID directly, they definitely have been affected a lot more than we were. We were lucky in the sense that apart from the first month, we have been able to carry on more or less, and having to actually do more work than normal, because we were taking referrals from the hospitals in the Greater Manchester region. Where I think the worrying thing is, I think there will be patients who probably are going to not present because they are worried of going to their general practitioners or to the hospital because of COVID, and elderly patients or patients who live alone. So we might see a surge in late presentations or late diagnosis as an effect of COVID. And as Alison obviously mentioned, the emotional impact of this on the patient directly and their extended family.
For sure. And
this is still to come.
Yes, it's hard to, there are no neat answers to those challenges, are there? Just kind of the people living with extreme anxiety and fear, and, really important issues about access to treatment, and I think the isolation bit is incredibly important. So we're at probably just our last 5 minutes, so I wouldn't mind doing a round to ask people either maybe one of 2 things. Lisa, we'll start with you. Either what your top tip might be to colleagues in the patient advocacy world in terms of being able to respond and continue to respond. But also, and we've touched on it, some of the, I guess, silver lining maybe moments from this experience.
Yeah, I think some of it has been said already, of the sort of the ability to be flexible and think outside the box, and how to be a little bit more nimble during this time with programming. And for us, it was taking what our budget was, the limited then amount, and how can we transition that to the work that we're doing, inclusive of like the digital inequity that Alison was talking about. But I think for us, one of the largest positive takeaways was that we had a lot of people who couldn't actually come into our brick and mortar centers, and whether that would be folks in advanced cancer or end of life, and they are now able to participate in services where they never could before. So there is a component of our cancer community that we were unable to help, that we really wanted to be helping, and found a way to do it now that they don't actually have to travel. But we'll be working on that digital inequity, Alison. That's our next big hurdle of how to get everybody.
Correct. Thank you. Yeah. Elisabetta, what is your silver lining or top tip thought?
I think that this pandemic taught us to be creative, to be more creative, more quick to react, to find new ways. And apart from the fact that we're forced to use technologies a lot more than before, I'm really happy that we were able anyway to give support in a different way from before. But I think that we had a lot of followers with success. The reactions were positive.
Brilliant.
We even, in 2020, we were celebrating our 10th anniversary from the establishment, and we had planned before a big theater event, music show, and we made it on the Facebook. We recorded it and we put it for 1 month on Facebook. And we had a lot of visualization, and that was a way to stay near our patients. They were at home, they could watch a nice show to celebrate with us.
I think that's so important that, technology can help you hold on to your community and take them with you. Andrea, last thoughts? We're sort of down to the last 3 minutes.
Yes, I think so. As well as Elisabetta said, we need to use the new technology. We must be flexible in these times, and we need still connections and cooperations and full information from every side to give it away to people who need the information, and therefore the technologies support us.
Thank you. Iko?
Let me catch it from the emotional side. That I'm not sure this is the right word, but endurance. Is it?
Yes,
endurance.
It is the right word.
For the patient groups and for the NGOs, and thanks to this online world, we can talk and we can discuss problems and we can strengthening each other. And I think this is very important, like this event today. So this is my message.
Meghna, last thoughts.
Well, I think this has taught us that we can, obviously, under pressure, we do perform well. And I think as a team, I wouldn't have imagined the number of patients that we somehow managed to still operate on, and the virtual clinics that we have carried on doing. I do worry there will be some patients who probably would benefit from having a face-to-face consultation, but given the circumstances, we have done probably better than I could have imagined people to have, and most people have pulled up their socks and got on with it rather than complaining about it.
Yes, and I think we're all eternally grateful to the work of people that are in the health service. And Alison, to you.
I think as a nurse working in a hospital, the endurance and resilience of the staff has been amazing. I think we've pulled together, been redeployed, worked as a team, and there's a real sort of family feeling, although people are tired and stressed by it themselves. But I think that's been a very positive side to see. And I think post-COVID, won't it be great if patients get the choice of, would you like a telephone video call or would you like a face-to-face? So I think we will have the best of both worlds eventually. So online and face-to-face.
Thank you. Well, thank you all. That was just such an interesting and rich conversation, and really, such insightful perspectives. And thank you for making time and sharing those with us today. I'm just have always learned so much from these sessions. So just to say, and also to thank everyone who has joined us today. I hope you've enjoyed this as much as I have.